So, Charlie, after last night's election, now that you've had maybe a half day to reflect on it, what are your first thoughts about the election, what it means for Truman, what it means for our patients?
Yeah, so I've had a half day. What I have not had is a full night's sleep because I stayed up and watched it to the end last night. It's a really interesting question. I've had a lot of people ask me today, what does that mean in terms of Medicaid expansion? What's it mean for Truman moving forward? So I think what I tell folks, I think Medicaid expansion for Missouri is one of the 19 states that hasn't expanded. I think that's a challenge given that current political environment. The one thing that is really interesting about Truman, and particularly Truman in Kansas City, is that we're unique in Missouri because we're really the only true safety net hospital in the state of Missouri, and we're both a safety net hospital and an academic medical center. And that goes back to the decision that was made nearly 40 years ago when both city leaders, business leaders, county leaders came together and said, we need a rational way to care for the uninsured in our community. And that's how Truman was born. So we get money from multiple different avenues. So we get money from the city, we get money from the county, and then we get what they call disproportionate share money from the state and federal government. And when you combine all those together, we're able to provide about $100 million of uncompensated care each year to this community. And as I said, that happens here in Kansas City. It didn't happen anywhere else in the state. So as long as those funding streams maintain and are kept stable, we'll be able to continue to do that and continue to care for our patients and do it the way we've been doing it for the last 40 years.
So I know that the idea was that Medicaid expansion would bring in dollars, and as those dollars came in, then our disproportionate share payments would go down. So does that mean that that's not an issue anymore, that those dish payments won't go down?
Well, I think what you'll see, and this is just my analysis on it, so the 31 states that have done Medicaid expansion will probably see a reduction in their dish payments. But I think the 19 states that haven't done Medicaid expansion, they'll probably maintain that same level of dish funding. So it'll move to what's been described as a bifurcated system for dish payments. So I think that's really important. I think the other piece is the city and county funding that we get. So we have to continue our advocacy efforts to maintain both the funding we get from Jackson County and the funding we get from the city of Kansas City. But if we're able to do that, we'll be able to continue to do what we've done for the last 40 years, and that's really care for the uninsured in our community and do it in a way that is really high quality and makes an improvement in the healthcare system in this community.
So at the end of the day, people who've been concerned that last night's election would have a negative impact on our patients, you're saying there's a good chance that won't happen.
Yeah, I think that's exactly right. So, we're kind of in one of those, we need to wait and see a little bit, but we'll continue our advocacy efforts. But our present funding streams, I would say, are not at risk at the present time, and I don't see them being at risk in the near future. One of the things that we will advocate for is, we understand, the loss of Medicaid expansion, the changes in the insurance exchanges and the marketplace like that. We're going to continue to advocate for our existing funding, but we're always going to advocate for our patients. So our belief as a medical center is that our patients are better served when they have access to coverage. And we don't know what that looks like in the future. Is that the new version of Medicaid? Not sure what that looks like. Is the new healthcare exchanges or the new subsidies available that'll come out of some sort of new effort? We're going to advocate for that. We'll always advocate for our patients, but I think people need to understand that this is not life changing for us in the present future or in the present state. But we'll look at the future and we'll continue to be strong advocates, not just for Truman Medical Centers, but more specifically for our patients.
All right. Thanks, Charlie.
Thank you.